Hi everyone, my name is Dr. Gayatri. I'm a GP in the NHS and a functional medicine doctor. So recently I've had quite a few ladies that have come to my practice or approached me having been diagnosed with PCOS or polycystic ovary syndrome. So this video is all about that. Conventionally they've been given this diagnosis and then they've been left to their own devices, which is of course just based around symptom management. So PCOS, it's an endocrine disorder that affects a good 15% of women, and it is the most common form of hormonal imbalance. There's still a lot that we don't actually know about it, basically, but it is a metabolic disorder with hormonal kind of imbalances. So it's actually the most common form of hormonal imbalance, and in fact it is the most common in women of reproductive age. So some of the symptoms: facial hair, acne, weight gain, irregular periods, trouble conceiving. These are just some of the symptoms that are associated with PCOS or polycystic ovary syndrome. So if this sounds like you're not alone. PCOS does affect about 1 in 10 women of childbearing age. Now, it doesn't just affect women of childbearing, it doesn't just affect women of childbearing age. It is also an inflammatory condition with long-term health implications like obesity, type 2 diabetes, heart disease, mood disorders like depression, anxiety, and even some hormonal cancers like breast or ovarian and endometrial cancer. So the main hormone disruption that we see in PCOS is higher than normal levels of androgens. And androgens, you can think of them as male hormones. These are things like testosterone, DHEA, and they're responsible for giving the male kind of characteristics. So as women, we normally have these hormones, but in PCOS, we tend to see much higher levels of these androgens. So essentially, they've got a high level of these androgens, but also they have higher than normal levels of insulin, and this often goes along with insulin resistance, which is common in diabetics. But the most common thing that brings it to the doctor's attention is because that lady starts to have infrequent periods because of this hormonal imbalance. And the other way we tend to see it is when somebody is having a lot of trouble or a difficult time to conceive. Then sometimes they come with skin problems, sometimes excess hair growth, and sometimes it can even be the opposite, which is hair falling, so alopecia, which can also be a consequence of this excess of androgens. Now, here's the key difference between a functional approach and a conventional medical approach. So with a syndrome like this, I'm going to use IBS as an analogy, but irritable bowel syndrome, in the conventional setting, you will go to your doctor, you'll describe your symptoms, and in turn, they're going to give you a diagnosis that essentially summarizes your symptoms. Your bowel is irritable. You have irritable bowel syndrome. And then the treatments are pretty much based around managing these symptoms. So if there's pain, you're going to be given painkillers or analgesics. If there's constipation, you'll be given a laxative. If there's diarrhea, then you're going to be given something like loperamide. But in functional medicine, we're really trying to address the root cause and the underlying mechanism that contributes. So if we talk about it in the context of PCOS, I guess the key thing that I'm trying to point out here is that when we look at things functionally, we're not just thinking about how we're going to deal with the symptoms, but actually we're trying to identify what the mechanisms are and then address these mechanisms, because we know that's the only chance we have in actually reversing this condition, rather than just helping somebody live with it. Unfortunately, most women with irregular periods are going to go and see their conventional doctor, and they're probably going to be given the oral contraceptive pill to normalize their cycle. The bottom line here, though, is that oral contraceptives, they don't actually address any of the underlying causes that are associated with PCOS, and they don't lower any of the risks that are associated, like the blood sugar imbalance or the decreased fertility. So it's true that the contraceptive pill will regulate your bleeds, the vaginal bleeding, but that's not really a period. It's the bleeding that's induced by a combination of the estrogen and progesterone, which is in that pill. Anyhow, we will leave the oral contraceptive pill talk for another day. But they're essentially masking and hiding the symptoms of PCOS. So that's your conventional treatment. But from a functional medicine perspective, we're going to want to come back to all of those tests that we probably will run for you. So that's very comprehensive gut testing, blood testing, looking for heavy metals, and also any kind of non-toxic overload that might be contributing to hormonal disruption, immune imbalance, and causing this kind of chronic inflammation. So I personally do tend to stick with diet and exercise as the two most important pieces in addressing PCOS. And I know that that's quite boring, but exercise is really a must. The reason I recommend it is in this setting is because it improves insulin sensitivity, which of course, as we know, is one of the driving factors in some cases of PCOS. And for those of you who have done some reading and you're concerned about adrenal kind of dysregulation with exercise, then please don't think that that's the case. You might not want to do CrossFit 5 times a week, but moderate strength training, it's usually quite well tolerated. As a general rule, I tend to tell my patients that do anything that you enjoy and do it to a degree, do the exercise to a degree that leaves you feeling refreshed rather than feeling depleted. And then in terms of diet, I like intermittent fasting because again, it improves that insulin sensitivity. It also improves the lipid profile. But again, sometimes we need to be a bit mindful if we are worried about any kind of adrenal dysfunction, because intermittent fasting is also a mild form of stress on the body. So in a nutshell, functional medicine practitioners like myself will take quite a multifaceted approach to tackling your PCOS. So it might include optimizing your diet to improve that insulin sensitivity that I talked about, might be supporting that gut health to reduce inflammation, it might be reducing toxicity to encourage that hormonal balance, minimizing stress through some sort of lifestyle tweaks, and then of course there is targeted supplements and herbs to support these hormones naturally and further. So I generally do like to give a prebiotic supplement and a combination of vitamin D, K, B12, B vitamins in general actually, and magnesium glycinate, because it's quite hard to get magnesium in our diet alone, and it plays quite an important role in hormones, especially insulin, leptin, thyroids. It's also quite essential in production of estrogen and progesterone, and of course it's calming to the nervous system. There's also zinc, which helps to support the normal menstrual cycle, and in particular in this setting of PCOS, it plays a really important role in ovarian follicle development. So one of the primary issues with PCOS is that we don't see the normal follicle development happening, and that's how you get production of the eggs and the ability to conceive. Most of those supplements that I would usually do, sorry there's so many of them, there's quite a variety, but actually different ones will be used for different people, very dependent on what is the driver for that particular patient's hormonal imbalance. Trying to think where there's another big thing, which is of course a big part of managing PCOS, and that's getting that cortisol just under control, and that might include self-care, so getting into things like yoga, meditation, spending time in nature, walking in the woods, gardening, watering a plant, hanging out with a pet, I don't know, whatever works for you, but doing things that feel nurturing, feel supportive to the mind and emotions, help us face the daily stresses that we face, give us resilience, and they are the strategies really for managing hormonal health. So please do get in touch if you have any more questions. Do check out my website at www.drgayatri, which is spelled drgayetri.co.uk. The good news is that for most people, diet is an effective way to control the condition, and fortunately with an early intervention customized treatment plan that includes diet, lifestyle, supplements, and medication when needed, PCOS is a fully manageable condition. So that's all for me for now. This is Dr. Gayatri, working in partnership with you in mind to design personalised medicine so that you continue to thrive, not only today, but tomorrow and always. Bye now.